Living with a food allergy is living life constantly on alert. You're always checking and double checking the ingredients of every food you eat. Well, now there's a treatment that could lower your risk. It's not necessarily a cure, but could be the next best thing.
And it's so good to be back with Dr. Roger Friedman, an allergist and immunologist with Ohio ENT and Allergy. Hi, Dr. Friedman.
Hey, good morning. How are you, Robin? Great to see you today, as always.
And great to have this conversation. You know, food allergies, I have 2 kids, and I feel like I wonder if it's more prevalent or we're just more aware of it, but we just hear about it a lot more these days, right?
There's a little bit of both of that. Number one, food allergies have increased dramatically. They've actually increased about tenfold over the last 30 years. So that's very, very real. Of course, now in this modern age of instant information, we get instant information about this all the time. And so we do get sometimes even a little bit of food allergy overload on occasions, but it's very real. And there's some so exciting information that's happening right now about why it's happening. And also, finally, after my 40 years as an allergist, we have treatments for food allergies, and not just treatments of reactions, but actually to try to make the disease improve or even go away.
And I've heard immunology or immunotherapy. I mean, that word has kind of been tossed around in a lot of the medical field. So I want you to talk about it when it comes to these food allergies.
Up until the last few years, the only option we had with food allergies, and it's still a good option, is to avoid the food you're allergic to. But as we all know, sometimes things happen, and sometimes mistakes happen, and sometimes people do their best to avoid a food, but they may still eat it. And those consequences can be very serious, obviously, especially peanuts, tree nuts, shellfish, and other fin fish, regular fish. Those lead to about 95% of food allergy deaths. Finally, after all these years, we now have an opportunity to improve our children and our adults' lives who have food allergies.
And so talk a little bit about like what the process would be like for that. And then is this a cure? I mean, can they eat these foods or are they still trying to avoid them?
That's a very good question. I mean, that's the million-dollar question. And I'll go through that a little bit. First of all, what we do is, like with allergy shots, we give microscopic quantities of the food they're allergic to, and we keep increasing that dose over time until we develop immune tolerance so that the patient can now tolerate the food. And so what happens is that they come to our office, and on day one, that's a big day, they spend about 3 to 5 hours with us, and we give them multiple doses of the foods that they're allergic to. Presuming they do well, and most of our patients have done very well on day one, we then send them home with 3 milligram peanut protein doses, and we dissolve it in Kool-Aid, and they take it every day for the next 2 weeks on a full stomach, and they can't vigorously exercise for 1 hour before or 2 hours after. They can't take a hot shower right after. And if they're sick, if they have a fever or ill, they need to call us to adjust the dose. And all of those factors, the reason we have them is so that the patient won't absorb the protein too quickly. And then what happens is they come back in 2 weeks and we give them an up dose. Eventually, we want our patients to get up to 1 peanut, that's 300 milligrams. And presuming they do well, we then increase them to 2 peanuts, to 4 peanuts, and eventually they take 8 peanuts a day. But it doesn't always lead, in fact, it usually doesn't lead to a total cure. If they really want to eat peanut butter as a regular, they want a peanut butter sandwich. What we do with those patients is we keep them on 8 peanuts a day for about 3 to 4 months. And then we bring them into the office and we do a 24 peanut challenge. All right, we give them 24 peanuts. If they pass the peanut challenge, they can then become a free eater of peanut butter. So they can eat peanut butter sandwiches every day they want, as long as they eat their 8 peanuts a day.
You know, it's a process, but it sounds like that would probably be the best tasting peanut butter sandwich they had ever had in their entire lives.
The funny part about that is many of our patients, we've been telling them their whole lives, don't eat peanut butter, you may die. And now suddenly we're giving it to them. So a lot of them don't like the taste. A lot of them are still a little bit worried about it. And we've worked through this. And we've been able to do this with peanuts, with tree nuts, with wheat, and with egg. So we've been able to do this with a lot of food. So it's extremely exciting what we've been able to do, and I think our patients and families who have gone through the process, the vast majority of them have done it very well and are very excited about their outcomes.
Yeah, it definitely is great to hear about, things happening, innovations, changes, treatments, especially when it comes to food allergies. So Dr. Friedman with Ohio ENT and Allergy, it is always good to chat with you.
Thank you, Robin, and have a Merry Christmas and Happy New Year.